This child is an example of extreme weakness and extreme musculoskeletal deformities. For several years, the parents of this girl, who is now 9 years old, tried to make her crawl and walk by very intensive training for up to 8 to 10 hours a day, intended to teach her brain to develop these movements. However, rigorous training made against muscular resistance and imposed over weak structure resulted in pronounced deformities rather than functional achievements. Any movement that this child makes immediately radiates throughout her entire body, involving her head, neck, trunk, arms and legs. When she is relaxed, she just collapses forwards, being unable to have any control over her body position.
What a funny position.
Her head control is completely absent. Even a minimal movement of her mouth or slightest emotion end up with rigid arching of her entire body. She has no isolated control of any part of her body. Extreme deformities are obvious. Her chest is collapsed, shoulder blades shifted to the sides and upwards, neck is extremely weak, her legs are distorted and asymmetric. Okay, so get her back. 2 years later and about 2,500 hours of ABR, we see a very different picture. She can hold her sitting position with minimal external support. Her neck elongated and her head control improved dramatically. She can now turn her head without falling into rigid extension. The transformation of her ribcage is obvious, as well as the change in the position of her shoulder blades. The movement of her mouth, released, became quite independent from the overall movement of her head, which makes chewing and swallowing incredibly easier for her. Release of the mobility of the head and development of the chest brought the release of the arms. Position of the shoulder blades and clavicles clearly changed to a more normal one. As a result, this child now starts using her arm. Obviously, so far she has no control of her elbow and hand. However, further development of head, neck and trunk is going to bring consistent improvement in hand function. In this video, we've shown a wide spectrum of various cases, different ages, different severity of the problems. This video demonstrates that this entire variety has the same foundation: deficiencies of musculoskeletal structure at the core levels of the head, neck and trunk. Our main goal was to show that only the correction of these structures lays a solid foundation for development of functions of the arms and legs. The example of milder cases show that the complete recovery of structure and function is possible. In more severe cases, it just takes more time but follows the same algorithm. Core structures first, then peripheral motor functions. Without normal musculoskeletal structure, normal function is impossible. But normalizing the structure automatically normalizes function, without a need for special training. ABR stands alone among other rehabilitation methods. ABR brings predictable recovery of structure, while other hands-on methods see structural limitations as unchangeable, trying to squeeze better function out of poor structure. We hope that watching this video would help you to have a fresh look at the problems of posture and movements experienced by brain-injured children, and show you new opportunities to improve their life. We admire the love, compassion and dedication that you parents give to your children. God bless you all.
Hemel. En dan?